Let's talk about solutions for carpal tunnel syndrome. So the consistent theme is going to be a movement-based approach. A lot of symptomatic carpal tunnel syndromes are due to static positions. So our approach in these 3 exercises that I'm going to show you are movement-based. It's getting the wrist moving, the carpal bones, it's getting the muscles of the forearm released and moving, and it's actually moving the median nerve, which is commonly irritated with carpal tunnel syndrome, to move through the tissues a little bit better. So that's the consistent theme. Even if you have a more severe case of carpal tunnel syndrome that requires surgery, you still haven't addressed the movement-based problem. So even a lot of times surgeons will recommend a nice graded approach, median nerve glides and muscle work, even after carpal tunnel release surgery. So I want to talk to you about our movement-based approach. We're going to start with mobilization of the wrist. Now, this doesn't have to be fancy. Like, we're just going to move our wrists at the outer ranges of motion. So I like to kind of just start with this goofy looking just wrist circles. You're going to try to expand the range of motion, kind of find those sticky spots. Think about the last time you kind of moved your wrist in this direction. So what this kind of does, it doesn't have to be fancy, is it just kind of increases blood flow. A lot of times with carpal tunnel syndrome or any compressive neuropathy, is that the blood tends to stagnate, right? Like your prolonged positions on the computer or working as an esthetician where you're using your hands, but you're kind of locked into this position. It's kind of creating blood flow, oxygenation, and then kind of getting rid of some of those inflammatory byproducts that irritate that nerve. So all this is just kind of counterclockwise and clockwise mobilizations to the wrist. Then from there, you're actually just going to do kind of a self-myofascial release. So the median nerve kind of travels down through the elbow and through the carpal tunnel and through here. So all we're going to do is kind of have our wrist and elbow in a shortened position. We're going to take our off thumb, kind of apply a little bit of pressure, and then just slowly kind of go into a little bit of a stretch. So that tissue is shortened here and then lengthened here. You're just going to kind of scan that tissue using your thumb and kind of work in this area through here. Okay, you're not going to go right at the elbow, you're not going to go right at the wrist, you're going to kind of find that fatty part of your forearm and just kind of nice and easy kind of mobilize that. Generally, you don't have symptoms on both sides, so you can kind of just focus on the side that you are getting more symptoms in. Okay, if you do, just do it on the other side, no biggie. And then lastly, we're going to talk about a median nerve floss. So there's 2 types of flossing. There's sliders, which move the nerve in one direction, and there's tensioners that kind of pull on it from both. So I like to use a band, we've kind of discussed this in the past, to show the slider tensioner phenomenon. So if I'm kind of doing a median nerve floss like that, I'm pulling the nerve distally or towards my wrist. So it looks like that. Okay, then if I do a tensioner, it's me pulling my head to the other side. So this is kind of how we assess nerves, but a lot of times when we're treating them, we just move them in one direction. So what that looks like is I'm going to go here, and as I create tension there, I can slack that nerve and go a little bit further. Maybe I go back into shoulder extension, or I can move a little bit more through finger and wrist extension. So then that kind of comes back. And when I take my head the other way, that's a proximal slider. So now we're kind of moving it here. And we just kind of nice and easy progress that median nerve floss. It kind of gets that nerve moving, sliding and gliding through the tissues. You can always kind of check yourself to see how you've gained range of motion with the tensioner, but I would caution you on using that as a form of treatment. That's kind of more for in-office treatment where a clinician can kind of monitor your tolerance to the stretch on both sides. So I'm hoping that those exercises are helpful. These are something that you can do 2 to 3 times a day or as your symptoms dictate. You might get a little bit of symptoms while you're performing the movement. Just kind of back that off, monitor. They should calm down in a few minutes afterwards. You're not going to be causing a lot of pain or discomfort. It should dissipate pretty quickly, and if you do, then you're overcooking it. So let me know if you have any questions. Omni Chiropractic, providing solutions to pain and performance.